Hello, I am Dr. Rajitha. Welcome to Competency Based Anatomy, and today we shall revise upper limb spotters along with some important sub-questions. So let us start our session today with our upper limb spotters. So let's start. The first muscle here it is shown is Pectoralis major muscle, and Pectoralis major muscle gets origin from sternum and clavicle, and insertion of Pectoralis major to the lateral lip of intertubercular sulcus, and nerve supply of Pectoralis major is medial pectoral nerve mainly. Sometimes a lateral pectoral nerve also supplies to Pectoralis major, and action of this muscle is mainly it acts at the shoulder joint in flexion. And the next muscle here in the anterior compartment of arm is Biceps Brachii. It has got two heads, short head and long head. Short head gets origin from coracoid process, and long head gets origin from the supraglenoid tubercle. So this is Biceps Brachii. And nerve supply of Biceps Brachii is by musculocutaneous nerve, and action of it is supination at radial ulnar joint and flexion at elbow joint. And clinically biceps tendon is important as it examines the function of C5 and C6 roots. Next slide here, it is the posterior view of shoulder and arm, where we can see a muscle, bulkier muscle, which is a multipinnate muscle, and it is the common muscle of choice for intramuscular injection. This muscle is deltoid muscle, and the origin of deltoid is by three parts: anterior, middle and posterior. Anterior fibers of deltoid gets origin from clavicle, and middle fibers of deltoid gets origin from acromion process, and posterior fibers of deltoid gets origin from the lower lip of the spine of scapula. And insertion of deltoid is to deltoid tuberosity. Nerve supply of it is by axillary nerve, and action anterior fibers of it will help in flexion of shoulder, middle fibers abduction of arm above 15 degrees, and posterior fibers extension at shoulder joint. So here one more muscle we can see in the posterior compartment, which is called Triceps Brachii muscle. It has got three heads. Long head gets origin from infraglenoid tubercle, medial head below the radial groove, lateral head above the radial groove of the shaft of humerus. And insertion of triceps, it gets inserted to the upper part of olecranon process, and it is supplied by radial nerve, and action of it is mainly primary. It helps in extension of elbow joint. And the next slide here we can see the scapular muscles. So first is the subscapularis muscle. Subscapularis muscle gets origin from subscapular fossa, that is the inner surface of the scapula, and it gets inserted to lateral lesser tubercle of humerus. And subscapularis nerve supply is by upper and lower subscapular nerve, and action is mainly internal rotators. So this is a rotator cuff muscle. Subscapular is a rotator cuff muscle because it helps in internal rotation. And next muscle here we can see is the serratus anterior muscle. It gets origin by 8 digitations from upper 8 ribs and inserts to the costal aspect of the medial border of the scapula, including the inferior angle. The nerve supply of serratus anterior is by long thoracic nerve, and action it pulls the scapula towards the thorax. It is an antagonist muscle to rhomboids, and it helps in pushing and punching movements. It is also called boxer's muscle, and helps in the rotation of the scapula in overhead abduction. Damage to long thoracic nerve results in winging of scapula. This is the picture to show the intermuscular spaces behind or posterior to the shoulder and arm. So boundaries, first space here, this is the upper triangular space. This is the upper triangular space. Superiorly it is bounded by teres minor muscle, and inferiorly it is bounded by teres major muscle. Medially it is bounded by long head of triceps, and it has a content which is called circumflex scapular vessels winding around the scapula. Okay, so this is the upper triangular space. The next space here we can see is this is the quadrangular space, and one more space down, this is the lower triangular space. Quadrangular space, superiorly it is bounded by teres minor and along with the capsule of shoulder joint. Inferiorly it is bounded by teres major muscle, and medially it is bounded by long head of triceps. This is the long head of triceps, and laterally it is bounded by surgical neck of humerus, and contents are axillary nerve, posterior circumflex humeral vessels which wind round the surgical neck of humerus. Then the next space here, it is a lower triangular space. Superiorly it is bounded by teres major muscle. Here this is the tendon of teres major muscle before its insertion, and medially it is bounded by long head of triceps. Laterally it is bounded by the shaft of humerus. Content of this space is radial nerve and profunda brachii vessels. So we can see the contents of quadrangular space first as axillary nerve and posterior circumflex humeral vessels. And this picture shows the contents of lower triangular space. The yellow circle is the nerve, that is the radial nerve, and red circle is for the blood vessels, profunda brachii vessels. So now we can see all the three spaces in this. This is the quadrangular space, upper triangular space and lower triangular space. So this is the picture from the anterior side where we can see the branches from the brachial plexus. Here the most important thickest branch is the radial nerve, which is present in the axilla, and it pierces the intermuscular septum and goes towards the posterior side to supply the posterior compartment of arm. And radial nerve, the root value of radial nerve is C5 to C8 and T1. It mainly supplies triceps, anconeus, brachioradialis, and divides further into posterior, that is superficial branch of radial nerve and deep branch of radial nerve. This is the picture showing the median nerve almost running in the center of arm and center of forearm. It runs along with an artery here that is called as brachial artery. So this is the median nerve and running along with the brachial artery. So the root value of median nerve, it has got two roots, medial and lateral roots. Lateral root has got root value C5 to C7. Medial root has the root value of C8 and T1. And the nerve is the nerve of anterior compartment of forearm except flexor carpi ulnaris and part of flexor digitorum, that is the lateral part of flexor digitorum profundus, is not supplied by median nerve. Rest all the muscles in the anterior compartment of forearm supplied by median nerve. It also supplies to thenar muscles and first to lumbricals. Next about the brachial artery, here we can see brachial artery, which is the continuation of axillary artery from the axilla, and it terminates in the cubital fossa as radial and ulnar artery. It is the common artery of choice for recording blood pressure. Then we can see here musculocutaneous nerve, which is a thin nerve and piercing the coracobrachialis, supplies all the anterior compartment of arm, that is biceps brachii, brachialis, coracobrachialis. All three are supplied by musculocutaneous nerve. The root value of musculocutaneous nerve is C5 to C7, and it continues in the forearm as lateral cutaneous nerve of forearm. And we can also see in this picture the tendon of biceps, which is the content of cubital fossa here. It is the tendon which gets inserted to the radial tuberosity here. So here we can see the coracobrachialis muscle, which is a small muscle, and it gets origin from the coracoid process and inserts medial surface of the shaft of humerus and pierced by musculocutaneous nerve. And next is the biceps brachii, which has got two heads, long head and short head, and already we had discussed here biceps brachii muscle. This is the picture to show a deeper muscle in arm anterior compartment. This is the brachialis muscle. When we reflect the biceps brachii, we can see the brachialis, and it gets origin from the lower half of the shaft of the humerus, and it gets inserted to the ulnar tuberosity. Its action is mainly flexion at the elbow joint. Next, humerus. It winds around the medial. Because of its winding round, the humerus is also called as funny bone. It supplies all the intrinsic muscles in the hand except thenar muscles supplied by ulnar nerve. Damage to the ulnar nerve results in ulnar claw hand. And root value of ulnar nerve is C8 and T1 and occasionally C7 also, which arises from the lateral root of median. Okay, and this is the picture showing the cubital fossa. The cubital fossa is a triangular depression which is present in front of forearm, and the contents of the cubital fossa we can see here, the median nerve and brachial artery, they are running together, and you can see the reflection here. This is the reflected tendon of biceps muscle, tendon of biceps, and a radial nerve also from the posterior compartment peeps into the cubital fossa and goes back to the posterior compartment of forearm and divides there. And the roof is formed by mainly the skin, superficial fascia, bicipital aponeurosis, deep fascia, and median cubital vein. And median cubital vein is the vein of choice for intravenous injections. And floor of cubital fossa is, upper part is formed by brachialis and lower part is formed by supinator muscle. This is the picture showing the front of forearm, where we can see the most superficial muscle, which is called as Palmar longus muscle, and it is a degenerated muscle with short belly and a very long tendon, and it runs superficial to flexor retinaculum. The tendon is often used for tendon transplant and surgeries. Next is the ulnar nerve, which is present in the forearm along with the ulnar vessels. Ulnar nerve pierces the flexor carpi ulnaris muscle. This is also a picture showing palmaris longus running superficial to flexor retinaculum. This is front of forearm again, showing a deeper muscle which is called flexor digitorum profundus. To see this, we have to reflect flexor digitorum superficialis. So first, flexor digitorum profundus here. This is the flexor digitorum profundus, and it is the deeper muscle, and origin is from 3/4 of the anterior and the medial surface of ulna and also interosseous membrane, and it attaches to the palmar side base of distal phalanx. Profundus tendons go through the tendons of superficialis, and this is the reason it is called as the perforating muscle. And nerve supply of profundus, flexor digitorum profundus, medial part is supplied by ulnar and lateral part is supplied by deep branch of median nerve, which is called as anterior interosseous nerve, and action of this is flexes the fingers. Next is the flexor digitorum superficialis, also we can see in this picture, and flexor digitorum superficialis, it is also called sublimus muscle, flexor digitorum sublimus muscle, and it flexes the proximal interphalangeal joint, and origin by humero-ulnar head and radial head, which gets origin from humerus, ulna and the upper part of the radius from an oblique line. And nerve supply is by median nerve, that is about, and next is the flexor carpi ulnaris and flexor carpi radialis muscle. This is also, these two are superficial muscles present in front of forearm. Ulnaris runs along the ulnar border of the hand. Radialis crosses from the medial epicondyle here, gets origin, crosses the forearm and lies on the radial side or the lateral side of the forearm. So flexor carpi ulnaris is pierced by the nerve ulnar nerve, and it gets flexor carpi ulnaris gets inserted to the pisiform bone hamate and also continues as a ligament called pisohamate ligament, finally ends up in base of fifth metacarpal bone. The next muscle we can see is flexor carpi radialis. It gets origin from common flexor origin and lateral to flexor digitorum superficialis and inserts to the base of second metacarpal bone and helps in the flexion of the wrist and radial deviation. Here They can see the median nerve in forearm, which is a deeper and lies deeper to flexor digitorum superficialis, and it lies superficial to flexor digitorum profundus. And median nerve pierces the pronator teres in forearm. This is an extensor compartment where we can see the most lateral muscle called as brachioradialis, clinically important muscle because the radial nerve damage can be assessed by checking brachioradialis muscle. And the origin of brachioradialis is from the lateral supracondylar part of humerus and insertion to the lateral part of the radius above the styloid process, and nerve supply of brachioradialis is by radial nerve, direct branch from the radial nerve, and action flexion of elbow in mid-prone position is the action of brachialis. And he can see here superficial radial nerve, a branch of radial, and extensor carpi radialis longus. Extensor carpi radialis longus gets origin from common extensor origin, that is the lateral epicondyle of humerus, and insertion to the base of the second metacarpal bone, and action extensor of the wrist and also abduction or radial deviation of the wrist joint. Nerve supply to the extensor carpi radialis longus is radial nerve. Next muscle here, extensor carpi radialis brevis, which is also getting origin from the lateral epicondyle and passes beneath the abductor pollicis longus and extensor pollicis brevis and inserts to the base of third metacarpal bone. This is the picture showing supinator muscle. We can see the most deep muscle in the back side, that is the extensor compartment of forearm, winding round the upper third of the radius, and origin is from common extensor origin and supinator crust of ulna and insertion to the oblique line of the radius. And nerve supply, deep branch of radial nerve supplies, okay, the deep branch of radial nerve after crossing the supinator, it is called as posterior interosseous nerve. And as we all know, supinator muscle helps in supination at superior radio-ulnar joint. So we can see here posterior interosseous nerve going deeper to supinator and exiting out here, and this is the superficial branch of radial nerve. This is one more picture to show the posterior interosseous nerve in the extensor compartment. Posterior interosseous nerve innervates all the muscles on the radial and the dorsal surface of forearm except anconeus, brachioradialis, extensor carpi radialis longus. All these three muscles are supplied by direct branch from radial nerve. The next picture showing Pronator Quadratus. It is with the transversely running fibers which gets origin from ulna and inserts to the lower end of radius, and Pronator Quadratus helps in pronation, and nerve supply of Pronator Quadratus is anterior interosseous nerve, which is a deeper branch of median nerve. This is one more picture showing the Pronator Quadratus muscle. After cutting all the flexors, we can see this is the deepmost muscle present in front of the wrist. This is the flexor retinaculum. Flexor retinaculum is the modification of deep fascia present in front of the wrist. Attachments, it gets attached from the pisiform and hook of hamate on the medial side, and on the radial side from the scaphoid and the trapezium, crust of trapezium. And flexor retinaculum, near the crust of trapezium, it divides into two slips, superficial lamina and deeper lamina, enclosing flexor carpi radialis. And the structures running superficial to flexor retinaculum are palmaris longus, we can see here, and ulnar vessels and ulnar nerve, and cutaneous branch of ulnar nerve and cutaneous branch of median nerve. Okay, then next is this is the picture showing extensor retinaculum. Extensor retinaculum is also modification of deep fascia present on the dorsal aspect of the wrist, and it is an oblique band. It attaches on the lateral side to above the radial styloid process to the radius. On the medial side, it attaches to the pisiform bone, and it also attaches to the triquetral bone. Here this is the picture to show the anatomical snuff box. Anatomical snuff box is a triangular shaped depression which is limited above by the styloid process of the radius. Anatomically or clinically, this anatomical snuff box is important because the cephalic vein present within the roof of anatomical snuff box and terminal branches of radial nerve are present here, and we can also feel the radial artery pulse in the anatomical snuff box. Intravenous injections to the cephalic vein often done at anatomical snuff box. Coming to the boundaries of anatomical snuff box, laterally it has got two muscles. One is called as abductor pollicis longus, the other is extensor pollicis brevis, and medially one tendon which is going towards the thumb again, that is called extensor pollicis longus. These are the boundaries of anatomical snuff box. This is the next slide. It is the picture of Palmar Aponeurosis. Palmar Aponeurosis is a superficial longitudinal layer, continuation of palmaris longus. Function of it is to improve the grip and protects the underlying tendons. In this we can see the dorsal digital expansion and also the tendons on the extensor side or dorsum of the hand, extensor digiti minimi onto the little finger, along with the tendon extensor carpi ulnaris, and we can see the extensor digitorum tendon which is going to the index finger. One more tendon is seen, that is extensor indicis, and we can also appreciate anatomical snuff box which is bounded laterally by abductor pollicis longus and extensor pollicis brevis, and medially by extensor pollicis longus. This is the picture to demonstrate the Thenar eminence muscles. There are three muscles in Thenar eminence: opponens pollicis, abductor pollicis brevis, and flexor pollicis brevis. This is hypothenar eminence, where we can see three muscles again in this: flexor digiti minimi brevis, abductor digiti minimi, and opponens digiti minimi is a deeper muscle. This is the picture demonstrating the lumbricals. There are four lumbricals, first, second, third, fourth. They are getting origin from flexor digitorum profundus and gets inserted to the dorsal digital expansion, and these four lumbricals help in the flexion of metacarpophalangeal joint and extension of interphalangeal joint. This is a dissected hand to show the thenar eminence with three muscles: hypothenar eminence and profunda, flexor digitorum profundus, along with lumbricals. This is to show the opponens pollicis, which is a deeper muscle on thenar eminence. Here this is a dissected picture showing the first lumbrical between the tendons of flexor digitorum profundus. And this is a slide of dorsal interossei. There are four dorsal interossei muscles, and dorsal interossei muscles help in abduction of fingers. So you can remember dab. So this is a picture showing dorsal interossei pinned, and this is the picture of palmar interossei. This is a dissected picture showing the palmar and dorsal interossei both. Palmar interossei helps in adduction, so remember the abbreviation PAD. This is the picture of superficial palmar arch. Superficial palmar arch is nothing but the continuation of ulnar artery, and partly it gets contributed by superficial palmar branch of radial artery also. Superficial palmar arch is also called as superficial olar arch, superficial ulnar arch, and arcus palmaris superficialis, and branches of it is common palmar digital arteries, and each common palmar digital arteries again divides into proper palmar digital artery. I hope you liked my session. Please like, share and subscribe.